Good afternoon, everybody. Thank you for being here. Dr. Gupta is here with us today as well. She's been working very hard with her team at the War Memorial, vaccinating thousands of our neighbors. But we'll go through the data and then take some questions, clarify some things that I think are really important for the public to understand, and we'll move forward. So, a mixed bag. Unfortunately, we continue to see the loss of life in the pandemic. We've lost 6 residents of our county over the last 24 hours, 5 hospital deaths, 1 nursing home death. All 5 of the hospital deaths were female, ages 97, 82, 80, 75, and 72. I'm very sorry to all the families. And certainly, let's keep these individuals in our thoughts and prayers and their families moving forward. Looking at positive rate, 7-day average, 5.9%. This time last week, we were at 8.4%. We've seen a drastic reduction. We're going in the right direction. This isn't an accident. These things happen when we do things intentionally. When the public listens intentionally and does the right things, when we intentionally go out and test everywhere in the community to try to find every case we can so we can isolate it. These are all things that when we do these things and work together, we get results. And that's what we got, and we need to double down on these efforts so we continue to crush this virus and give time for these vaccinations to kick in. Looking at, just to give you an idea right now, we'll do a midday report on our community testing. We've tested 1,608 people so far at community sites, the On Center, and schools. We have 11 who have tested positive, so 0.68% positivity rate. Only 2 out of 1,000 so far in schools. So I'll give a final tally on social media like I do every day, but it gives you an idea that in the peak areas, even when we're doing asymptomatic community testing, you'd see positive rates in the 3% range, 2.5%. It gives you an idea that we're still making progress, which is important. Hospitalizations, 212, down 5 from yesterday, down 65 since last Thursday. Overall, hospital beds are in good shape compared to where they were. Keep going down with COVID beds, but overall, hospital beds in the region are in much stronger condition than we were. That's very good. 41 of our residents are in the ICU, and we have 11 residents now who are waiting to transfer to the COVID transitional unit at Loretto. Again, I want to thank Loretto for their partnership. They've been a key partner in helping build up back the hospital capacity. And again, want to thank all of our hospitals and all the staff working every day. You're heroes. New cases, positive. This is our high day, and tomorrow is our high day every week. We've been in the high 4s for probably a month on Thursdays and Fridays. Today we're at 330, so that's a positive 330 compared to where we normally are this week. Certainly still a lot of work. This isn't where we want to be, but we find balance in all these briefings. When you compare where we've been for the last month on this day, we were doing much worse. So going in the right direction related to cases. Again, Thursday and Friday, it's really when the national labs come back in with testing. So we see lots of tests and we see lots of positives. And so we expect another, Friday's always a high day too. We'll see what we get tomorrow. When we have testing, again, for symptomatic testing, the FSHAD Monday through Friday, 9 to 2, ongov.net/Cayuga Medical. If you have symptoms, turn times are very fast. So, we're seeing 24, 36-hour turn times on these tests. So, again, if you have any symptoms or you have exposures, we need you to get this type of test Monday through Friday at the FSHAD at the regional market. Another hopeful sign is is, remember, we built up a lot of capacity per day here. The demand at this site has gone down quite a bit. I'm hopeful that means there's less people sick, not that people are less engaged with testing. Weekend symptomatic testing, again, if you have symptoms or exposure over the weekend, Nescentia Health, 1050 West Genesee Street, 8 a.m. to noon. Again, that's same registration, ongov.net/Cayuga Medical. Go online and you can register for that. Asymptomatic testing, COVID-19.ongov.net. We do it every day here at the On Center. We go out in the community and have made it accessible in neighborhoods, building up a model at some point. If there's a lot of supply, we could use that model for vaccinations as well. But we are not there. We're close to supply right now, where we need to be. Asymptomatic testing sites this week. Today is Thursday. Today we are at the Pompey Fire Department. Tomorrow we will be at Tully Town Hall. Monday we'll be at the East Syracuse Village Hall. Wednesday we'll be at the Fayetteville Senior Center. Thursday, Onondaga Town Hall. Again, COVID-19.ongov.net to register for an appointment. Let's go over some information related to the vaccine, and then I'm going to let Dr. Gupta talk a little bit about whatever I miss, and then we can take some questions. Through yesterday, our pod at the War Memorial did 8,946 vaccinations. Today, we have 1,260 vaccinations scheduled, so we will go over 10,000 today, and tomorrow we have 1,260 scheduled. Monday, we will be moving our vaccination site here in this room at the On Center. So that's important for people that register. We, at this point, have not opened up appointments for Monday or Tuesday. We will make that call on Friday when we know what kind of vaccine we have available. We will make that call Friday. We'll let the public know, open up the links. As we know with other sites in the community, there's registrations that are registered out quite a while. We will work in 3-day increments because we will never cancel an appointment at the War Memorial. If you have an appointment here, that means there's a vaccine here for you. So again, we basically received 3,600 doses of vaccine Tuesday evening. We started giving them yesterday, today, and Friday, and we're essentially out. So we'll ask for redirected doses to come, and then if we get the redirected doses, which we may, we'll open up appointments for Monday and Tuesday, and then again on next Tuesday, we'll hear from New York State how many doses they're sending us, and then we'll open up our calendar next Tuesday for Wednesday, Thursday, Friday, and hopefully Monday and Tuesday. We can schedule them hopefully in advance because they send us more vaccine. But that's how this is going to be. It's going to be like this. Also, who will now qualify in 1A and 1B? We had some clarification. The state has clarified that those who are immunocompromised are not yet in 1B. They will be, but not yet. That was clarification the state gave us today. Who's in 1A? 1A we went through, right, already. Who's in 1B? Over 65. First responders, including public safety, communication, and court officers. Correction officers, including probation and juvenile detention staff. Pre-K through 12 staff. In-person college instruction. Child care workers. Public-facing grocery store workers. Transit workers, homeless shelter staff, and clients. Over 100,000 people in our community. There's no point in calling or going online right now because there are no slots available right now. Again, Friday, we'll let the public know, and hopefully we'll have slots available for Monday and Tuesday. But again, we will get more vaccine in on Tuesday, and that will determine the available slots for next week. With our seniors over 65, we acknowledge and recognize and even those with language disparities, if you are having a hard time getting on the website, and we've set up 211 for you to call. Each day we reserve so many slots for 211 to register you into. So if you call 211 today, they have nothing to give you because we've given them no slots. All the slots are full. Again, Friday, if we know there will be slots Monday and Tuesday, we will give 211 slots for our seniors 65 and above. And that's been a good resource. They're getting a lot of calls from people. 211's not going to be able to schedule in advance. They only can schedule these slots that we give them that day, but we will give them slots every day that we have vaccine. So I think that's important. There's been a lot of questions on the second dose, right? More people are getting your first dose now, a lot of questions. You have to go to the same vaccination site. You have to get the same vaccine. At our site, what will happen is we take your information when you come. We get your email address. If you don't have an email address, we get your phone number. We already reserve a dose for you in the proper week when we vaccinate you the first time. What will happen is we will email you a proper time or a registration link, and that's when you will get your second registration. What you should not be doing is getting your first dose at the War Memorial and then registering at the fairgrounds for a second dose. That's not how this works, and let me tell you why. We have been giving Moderna. The fairgrounds is giving Pfizer. You can't mix the two, okay? So you go to, at some point, we may be giving Pfizer and Moderna and Johnson & Johnson. That's our logistical issue to worry about. But you have to go to the same spot you got your first dose until you hear differently from us or the state of New York. But for our pod, we're the authority on this. You have to come back. If you get your first shot with us, you have to come back to us. You can't go to another site. So again, we have your information. We are keeping a second dose calendar with a separate link. We will send that on as you get closer to when your second dose is due. Case investigations, again, once you get the text message, please respond. This helps our internal workforce and infrastructure so we can quickly get our case investigations over to contact tracers and they can start doing their job. If you get a text from 833-634-1564, that is us, and we want you to text us so we can begin our investigation, or we can talk to you on the phone. Many people can use text and download the information, so we appreciate when they do that. Saying that, I will invite Dr. Gupta up to make any other comments that I might have skimmed over. Doctor, come on up.
Good afternoon. So I have not been here in quite some time, has been busy working, and you have been getting a lot of info from County Executive. So since December 28th, as you know, Onondaga County Health Department clinic has vaccinated almost 8,949 or 46, I think, as of yesterday, and by the end of today, it will cross more than 10,000. It is a big undertaking. I just wanted to come and sort of give you an overview how this process works in our clinic, because somewhere we don't do these mass public health clinics, but as a part of our public health preparedness work, under our Article 28, we are going to stand up a clinic anywhere in the community if it's needed in a very short notice, because that's what we do as a health department. And this is true for all the local health departments. We work to prepare ourselves, and that's what the clinic is standing up. And one thing, as a health commissioner, so I am overseeing the operation as what we call incidents commander and intimately involved in everyday planning. However, it is so important to remember, for a small operation, we can do ourselves, and a lot of times we don't need. This sort of in pandemic, for the large-scale work, needs a strong commitment and support from the county executive, which county executive has been so intimately involved. He has continued to update you every day of this progress, and tirelessly working to advocate to get maximum number of vaccine in our community. I cannot tell you how many times we talk during the day, and he is there to get us the supplies for anything which we need to make our operation successful. So I'm fortunate to have that support. And our Deputy County Executive, Rooney, and the Commissioner of Emergency Management support is so critical in our planning and operation every day. We meet every day to discuss details, nuances, at times, and many times of the day, to get the resources, to get the vaccine, and what is needed to have a successful operation. And alongside, when you are having case investigation as another work which is happening, as well as intense testing, as County Executive just explained, that continue to happening at the same time. In terms of how does the POD, what we call the Point of Distribution Clinic, public health clinic works, I meet with my team every day to review both medical operation and clinic operation. For the smooth operation within the clinic, from the patient perspective, as well as how the process goes through without any problem. In the clinic, you will find the medical team of nurses, medical director, vaccine coordinator, had excellent support from every county departments. And I'm emphasizing every county departments which has been provided by our county executive to support, and many volunteers, all working alongside with one goal, to vaccinate as many people every day possible. It's truly a teamwork. So how does it work? I don't know how many, if you have anybody got vaccinated or you have seen some glimpse of it. If you come to the clinic, you will be greeted by a person, usually there's a security officer. Then you go and then into the registration. At the registration, they will be checking your ID, whatever you are qualified to get 1A or 1B, and making sure you are here, a right registered person. If not, then you are going to be turned away. It is very crucial because we want people to follow the process. Once that is done, you will be guided to a public health educator who will give you guidance about the vaccine, and then you will continue to move towards a nurse at this time in the War Memorial, and it will be here to a nurse's table who will vaccinate you, provide the final recommendation or guidance, answer any question, and then you will be asked to wait for 15 minutes because that's a recommendation for both vaccines, both Moderna and Pfizer, and 30 minutes for those who may have some kind of a history of reactions in the past and we are concerned. There's a lot of activity goes on when you are in that floor because people have questions. They have vaccines a few weeks ago. They have some questions about their medical illness in the past, history of that. All these things have to be addressed in a very timely manner so the smooth operation continue to happen and we can vaccinate maximum number of people. As you know, we are using at this point Moderna vaccine. However, we will be using Pfizer if that's the vaccine we have available in the near future. They're two different vaccines because they have the same principle with the mRNA vaccine, but in terms of having second dose, there is a difference. One is 3 weeks for Pfizer and 4 weeks for Moderna. At present, we are giving the first dose of Moderna. We have not been there yet to give second dosage. In a week from now, we will ready to give our second doses of Moderna. Some of them will have, some of the people will get next week a second dose of Moderna who have received vaccination from someplace else, and we have, in a good faith, have taken that to take it. But it has been a really concerted, coordinated effort. And as County Executive mentioned, we don't want people to have vaccination scheduled at two sites. It is so crucial that the second dose is going to be given by the same place. Unless there are some extenuating circumstances, we don't recommend that. One other confusion, I think for the second dose, we are going to give second dose because this is CDC recommends in the United States of America. At this point, there's no difference. So if you are going to get first dose anywhere, whether it's in a hospital, whether it's in any federally qualified medical center or in urgent care or at our clinic, you are going to get a second dose. The way it works with the allocation, that when we enter the data in the New York State Immunization Registry, based on what is being provided, that's how we get the reallocation of the second dose. It just doesn't come otherwise. So it is very crucial for people to understand that if they go and get the vaccine, one from here, and then schedule second place else, it creates a lot of logistic nightmare for all the sites. And what will happen at the end of it, those people who should be getting their first dose will get sidelined, and that's not anybody wants. So, and as County Executive mentioned, in terms of second dose vaccination, right now we are going to be reaching out to by the emails or the phone, whichever way is provided to us. Majority of people have so far done the online registration, but as we move forward, we will have some phone support for them who have not been able to, who have somebody else like 211 has done scheduling for them. So we will be making that extra effort. However, in next near future, we are looking to have a online or on-site registration for the second dose right there. But this is work in progress. As you know, there is a saying that we are flying the plane as we are making it. That's something, I hate to use that word, I don't like that, but we are using it at this point. We are giving the first dose with the intent you are going to come back for the second dose, and you're going to stay tuned for what communication is going to come from the county in terms of your second dose registration. However, with the time, we certainly are looking to make much more smoother process. So I ask for people's patience, and also reassure you that you gotten first dose, you are going to get the second dose. There is no ifs and buts in there. The only thing changes in the policy if it changes at the CDC level, which is not the case in this situation. We also are, so please do not book second appointment, I think, as I emphasized. The other thing which I wanted to go over some of those post-vaccination. People have side effects. We get a lot of calls. You can get side effect arm pain. That is something very common side effect. You can get some side effect at the local site, even a week or so. Please make sure you report that to the CDC. We always provide that information with the WeSafe or WARES, W-A-R-E-S, because CDC needs to know that what is the uptick of this vaccine and what kind of side effects people are noticing. That's how they will continue to look into the future when they look for some other ways to maybe new vaccines. I think it's important. It's very critical. Few words about, I think we talk about some of the registration right now, our registration is web-based. We are not doing phone calls. Most of it, 211 has been very helpful for the seniors. We continue to engage them for our seniors. We also will be looking to do some other ways to reach out to the community because of health equity issue. Not everybody has computers, not everybody has those access. So we are working to identify ways where we can go to maybe where they are or try to bring them in a group. So these are work in progress, and rest assured we are going to provide that opportunity to everyone, and we have had lots of discussion. I have lots of discussion with the county executive and Rooney, and we are on it. So I don't think there is any concern should be in that way. Yes, people do want the vaccine for elderly, for those physical assistance and special need. We do accommodate in our clinic. We have a separate area where people, if they have some discomfort being in a large place, we have separate area where our nurses go and vaccinate them. It provides them protection, it reassures them. We also have in areas for where people with physical disability don't have to walk that far. We are trying to make that arrangement right here. I looked at the plans yesterday, we did the walkthrough. So we are making sure that we are providing a really excellent support to the community so that they can have a good experience when they are coming here to our place. So broader availability of vaccine remains a concern, as has been said so many times. At this point, hospital has vaccinated their staff. They are continuing to go and get the second dosage. New York State Department of Health has their own at the state fair. Pharmacy, as you all know, I'm not saying anything new to you. Private medical providers are going to start getting their vaccines, and urgent cares and federally qualified also. We are one of the largest part, I think, in the New York State, quite a bit, and we have vaccinated quite a bit. So we are fortunate to have that support, I can say. Finally, as we are focusing on vaccination, we really cannot get our focus off from the investigation and contact tracing and testing. And in this pandemic, triad of success for this pandemic is testing, case investigation, and contact tracing, and mitigation, which is the final destination for the vaccination. We will need to continue to follow public health measures of wearing masks, washing hands, social distancing, and staying home when sick. This is very crucial because immunity does not start right away. You can't come to the clinic and say, hey, I can go to the party. That is not one should do. Minimum of 2 weeks, and you really need 2 dosage at this point, what we have information. So people really need to be very, very vigilant and cognizant is that it's not a free ride. You got the vaccine and you can do anything you want. And then staying home if you're sick. So I'll be happy to answer any questions regarding that. Thank you.
Thank you, Dr. Gupta and her team, all the work they're doing. I think it's important everybody understands. So with the vaccine, the supply is still the issue. The distribution's there. Again, we essentially will be getting through with this week's supply within 3 days. The reality is if we wanted to, we probably could have gotten rid of it in 1 day if we staffed up for 1 day. So when we have the supply increasing, our challenge is to use and maximize the distribution capacity that we've built, and we mobilize that, right? And so we'll do that. So we're never going to be sitting on supply. We want more vaccine so we can get it into our community faster, because that's how we crush this virus and that's how we win. In the meantime, a couple of things I just want to highlight, some positive news, but also a little bit of a warning. I'm pleased with the fact that we are now essentially in yellow zone for restaurants. That's something that we've been advocating for, disproportionate impact on these business owners and their livelihoods and their families. We have data going in the right direction, but at the same time, let's not kid ourselves. In the summer, the big driver of cases was bars, and so let's acknowledge we need to do better this time around. We need to keep these businesses open. We need to follow the rules. Businesses need to follow the rules that they attested to. We certainly will be enforcing it, but we're very happy for these businesses. And overall, I know we have I won't be talking to everybody tomorrow, most likely, but I know we have a big football game on Saturday, I believe, right? Josh, is it Saturday? I know you're a Bills fan. I'm a Packer fan. Yeah, okay. So the Green Bay game, which I think everybody will be celebrating with me, is in the afternoon, and then the Bills in the evening. Now, I don't think there's been a Bills night playoff game since I was probably 12 or 13. So let's just be smart, folks, okay? We know the gatherings drive spread. Let's just be smart about this. It's an awesome opportunity for us to enjoy all of our favorite NFL teams in these venues, but let's not go backwards from this. Let's not have a contact tracing event where we're talking about the holidays, New Year's, and the Buffalo, is it Baltimore, Josh? Buffalo-Baltimore game. Let's not have that happen, okay? So, but I'm really, really happy. Josh Allen's having a great year, almost as good as Aaron Rodgers. And so I'm pretty psyched about this for everybody. But let's keep these restaurants open. Let's help out small business, but we can't go, it's balance. We can't go backwards on all this. We've made too much progress. So saying all that, questions?
So just to be clear, you are looking at options for maybe possibly an in-person sign-up to get vaccines. What about maybe a wait list option? I know some other states have been doing that.
Yeah, we've looked at it. I saw Nashville had an interesting wait list. I think the challenge is we want to do things that don't create more work. So if you set up a wait list, right now demand's not the issue, right? We open up a slot, within 10 minutes it's gone. If you create a wait list, does that mean that you now create 250 new calls to the health department in my office saying, we're on the wait list, when do you think it's going to come free, right? So we're assessing all of this. The reality is 1B's expansion, although I'm happy for everybody in there, was problematic from a logistics standpoint. So now we have to deal with it. Hopefully we'll get more supply, and in the next 2 weeks, as we're giving out second doses, we're getting through a lot of first doses as well. So the logistics of this are always going to be a work in progress. And I think the big thing is that what we're letting you know is when there's new appointments, and we're not letting people schedule out months in advance because we don't know what the distribution of the vaccine is going to be. This past week, we got as much as the week before. Other counties got less. So I think it's important that we go in these 3-day increments, have been working well for us. And I think that our goal is we'll vaccinate everybody within 3 to 5 days when we get the supply. And we'll also, nobody's getting left behind in this process. Everybody's going to get a vaccine that wants one.
And for seniors who don't have, internet access or may not have a family member, I know we've been receiving a lot of calls, as I'm sure you have, kind of not having that access. So are you looking at that in-person sign-up option as well? Well,
the problem is with that is, so 211 is the right place for seniors, right? So, and eventually, I think the second challenge with seniors, and Dr. Gupta referenced this, is you have nursing homes have gotten vaccinated with their first shots. Assisted living facilities, most of them have seen a first shot and are all scheduled at this point. Independent living facilities are a challenge, right? It's tough if you're 90 years old to drive downtown, and even if you have a free parking spot and go and then wait. We recognize that. We're looking at strategies on how we can potentially have mobile medical clinics going to some of these facilities. Again, the challenge being we don't have enough supply right now to do it.
Out of the 9,000-ish doses that have been given so far, Dr. Gupta mentioned side effects. Are you aware of any serious side effects that required medical care, anything like that?
So most people have a little lightheadedness. They didn't feel, somebody got nervous a little bit. So they stayed there. One person we did send to the hospital, but that was not it was not anaphylaxis or anything. I think sometimes because it's a public clinic, it's very, we don't want to, we have limited things there. Even though the person is stable, if somebody doesn't have a family member with them, how do you send them out to make sure that you are being taken care of it? So nothing major has happened in our clinic. Thank God, touch wood, I would say that at this point.
The one that went to the hospital, why was that?
Oh, it's just something because if that person gets sort of a nervous, and we don't have that many equipment to have all those assessments there besides the blood pressure and temperature checks, and there's no other family members, it makes it a little harder. We watch them, and there's nothing there more we could do. So either you go to the doctor's office or you go to the hospital. And initially, and at this point during the COVID time, we don't have anybody who can handle these things, even in private offices. In normal circumstances, that person would be going to a doctor's office. That is not because your doctor can see you, you can go home, but in COVID time, everything changes. So, so far, we have had no one who have like a severe allergic reaction sort of thing right there. There are some reports of local reactions, which is something which we expect a few days later, versus there are some physicians have called me that their patient had some allergies. So these are normal thing. I shouldn't say normal, but these were sort of expectations, and we are encouraging people to report to their physicians. If they call us, we report it also, but there are not many. We have not gotten that many calls for us so far. So almost 10,000 people got vaccinated, and small things is, I mean, if we have few, very far and few, that's not, I would say that's a pretty success.
And who should, if people do get reactions, they should report those, though?
So that's a, CDC has that We Safe. You know, it's something people can report themselves. It's a We-Safe. We give them in a card. If you go to the CDC website with the COVID, you will find it. There's another one is WARES. It's a Vaccine Adverse Related Reaction, I think something stands for. So there are two places. Usually physicians report from the WARES and people report from the We-Safe. But anybody can report in both. Because you want to send that information to CDC, which they will assess that how many people who have gotten the vaccine, how many fall into the local reaction, how many fall into the face edema, how many fall into general ache, right? All those kind of things are very important because probably 6 months, a year down the road when we get the report, we'll be able to see what is overall side effects profile of Pfizer versus Moderna, or when other vaccines come out is Johnson & Johnson and AstraZeneca. So this is crucial, I think, for the informational point of view.
And the person who went to the ER to get checked out, they didn't have to be admitted or anything?
We don't know that. Most of the time, I mean, we don't follow those things in general most of the time. If there is any question comes out, we certainly would have been notified, but we did not hear anything, because a lot of times, people come to our clinics. If there are anything which our medical clinic, even in our STD clinic and TB clinic, we will send them to the hospital. That's a routine process any medical clinic will do. When I was in private practice, if there are things which I could not do in my office, that person go to the ER. That's how the standard protocol is. So, okay.
Other questions? Yeah. Yeah, I think there was, if you look at what happened, and you can reflect, over the last 90 days and cases, we're going to get to elevated cases regardless. I think we got there faster than we wanted to. A lot of that was driven by holiday gatherings on Halloween, but also I'm 40 years old. I still know a lot of people that hang out in bars, and bars are fun. I like hanging out at bars sometimes. You can't do that in pandemics. And so there's a lot of people that were in certain areas where there's contact tracing within establishments in downtown and other parts of our community as well. So we know this. The restaurants and bars, when the rules are followed, I think there's still elevated risk, but I think things can be successful, and we need these businesses to be successful. Part of the vaccination process is really turning the corner, and so the more the case levels fall and the more the vaccinations increase, the quicker we are to winning this war. There needs to be something left, right? Think about all the progress we've made in our downtown and other business districts. You can't have them shuttered and not give them a fighting chance. They're never going to do well in a pandemic. Many people will not go to the restaurants. They won't feel comfortable doing that. But you need to give them a fighting chance. So that's what getting them out of the orange zone to the yellow zone is to give them a fighting chance. We'll work with them to make sure that they're following the rules and the guidance, and so that they're doing everything they can to mitigate any potential risk that's there. But the best thing we can do is, again, follow the basics, avoid these gatherings, these large gatherings, And when you have symptoms, stop the symptomatic spread. Stay home when you're sick and get a test. If we can do that, we'll continue to get our numbers down, going in the right direction, and we'll continue to get the vaccinations up.
Yeah, you were the doctor playing. Syracuse played Georgetown on Saturday. A couple days later, Georgetown goes on pause. When we had on the radio this morning, said it doesn't affect the team at all. Can you explain how it is?
So there's well, we don't know what caused the pause with Georgetown, right? And so what would happen is if there was deemed to be a risk, the Georgetown medical director would reach out to Dr. Gupta and her team and explain what happened. And so my assumption is that Coach probably has an idea on what happened. He probably called Patrick Ewing, asked what happened, and that it probably didn't have an impact. You can have a program on pause and not have it be a situation where a player was positive. It could be part of their bubble, and a contact of a contact is not a quarantine.
When you look at the positivity rate that's dropped pretty dramatically in the last couple weeks, what do you think, given that we had Christmas, Hanukkah, Kwanzaa, New Year's, and it didn't necessarily cause the spike that we saw from Halloween?
Yeah, it was an uptick. So we went from, remember, after Thanksgiving, we started to get it down to levels that we're kind of seeing right now. And then we had the holidays, so we saw an uptick, but we didn't see the 100, 150% increase in cases from where we were. That's what we saw with Halloween. Where we were, Halloween happens, we see 100% increase. Halloween to Thanksgiving, 100% increase. That didn't happen. We were preparing for 600 and 700 cases a day. It just didn't happen. So part of how I think we're getting this out is we made intentional efforts to go out and proactively test all over the community. A lot of times people freak out when they see high test days. When I see a high test day or a high case day, but there's a lot of tests with it, I don't freak out. I think we did our job. We found virus and we isolated it. That's how you get in front of it. So I think that had a lot to do with it. And I think also, I think the public overall did a much better job listening to the public health guidance that Dr. Gupta and others gave them related to doing Christmas differently, New Year's differently. I think the numbers are bearing true on that. Again, remember, this time of year, any COVID strain, any virus does better. We're all indoors. We always knew we would get elevated cases. It just we didn't think we were going to get to 400s as quickly as we did.
Do you plan on working with the Sheriff's Department or SPD to increase patrols around these bars and restaurants, or is that kind of a wait and see what happens?
Yeah, so we have our own different enforcement unit that we've had, and they'll be activated. Tim?
How, do you know what the patient count is now at the Loretto Transitional Facility, and are they getting close to being full? Because that's been a big factor.
So there's two floors open, so essentially you have an 80 to 90 patient capacity. But remember, Tim, is these residents eventually test negative. So when they test negative, they go back to whether they were living in Loretto or a different facility, then they go back. So you kind of have like a constant pipeline. 21% of our existing hospital COVID patients are still from congregate care settings. So there's still about 50 out of the 210 or so that are still in the hospital. So eventually they're going to recover, and then they'll flow back into the transitional unit until they test negative. So the good news is I think we only had, this is probably the best news, I'm sorry, I didn't even share this with you. Out of the 330, one of them was a senior facility resident, one. So that's really good. That's really good.
Is that a fairly steady ratio, 20 or 25% of the hospital inpatients come from nursing homes?
Yeah, it's actually dropping. It was as high as almost 33% at one point in the peak, but it's been consistently dropping. And I think it's probably an early sign that some of these nursing homes have received their second doses now, I believe. And certainly the first doses for most of them have been over the 2-week period that Dr. Gupta's referenced. So there is levels of, I think, immunity that's building up there. And so that's really promising when you look at who has been getting really attacked by this virus. It's our seniors in these congregate care settings.
Thoughts on Governor Cuomo saying that I-81 project will break ground next year?
Yeah, I saw it. I didn't know about it in advance, so I think it's an aggressive timeline, but we'll see. The governor puts out timelines, and he pushes pretty hard. So we'll see. I'm interested to see how this comes together. Obviously, a $2 billion project to get going on that. That would mean the federal government would have had to approve the plan and confirmed at least 80% of the funding. So if those things are have already been accomplished, I'm not aware of it yet, but it's certainly a major project that will likely impact our community for 4, 5, 6, 7 years.
Had you had any indication that the governor's office was going to approve your request to lighten the orange zone regulations, or was that all?
No, we had good conversations. My understanding was that the move was going to happen. I think the court case in Erie County may have just said, all right, today's the day. But I through our conversations with senior officials, we knew that the concept was, one that they liked and appreciated. So again, this is, I think, a win. We still have, these are not regulated. They were regulated to begin with. Yellow zone still has more regulations. There is elevated risk in businesses and all sorts of businesses, right? Whenever people are together, there's elevated risks. So I think it's a win-win. And again, we'll work with the business owners. We're going to enforce. There's still got to be, close the doors at 10 o'clock before, remember, the most, what we thought the most impactful part of the regulations when we were seeing an uptick after Halloween was the hours of operation, not the capacity in it. At some point the industry changes from a eating to a drinking, and it's harder for businesses to regulate when folks have had a couple drinks.
Hey, Ryan, just in reaction to DC news, Congressman Katko voted for the impeachment. Are you hearing that, is he going to face any pushback from local Republicans, do you think, or how's that being received?
Yeah, I think anytime you take, I think the congressman had to vote his conscience, and I think he did. And so if you look at the situation he's in, his critics before yesterday will give him no credit for his vote, even though that's how they wanted him to vote. Absolutely zero credit they'll give him. And people on maybe our right flank will be very upset with the vote. So he was in a position where the easy out was for him just to vote against the impeachment, and he voted his conscience. So I think I think that says a lot about his character.
Hey, just a stupid detail about the vaccines. You mentioned people who are waiting for their second at the War Memorial now here should wait for an email. We've been getting questions. How long do they wait, or is there?
Yeah, so we'll send out communication within the week before they're supposed to get the vaccine. So we know we get a dose for every first dose we give. We have a backup dose that is being stored somewhere. It's not, we don't have our hands on it yet, although I'm told that they have been shipped for the first week, for the first round of second doses. And so everybody's got a second dose waiting for them. It's easier for us just to send out a blast email to everybody saying, here is a link with the appointments now, go make your appointment.
Pretty much within the week of when they're due.
Correct.
said that you don't hold the second dose, but it's like kind of flagged somewhere.
Yeah, they've started to be shipped to the hubs. So as the second doses, remember, they're not going to send you a second dose when you're still giving out first doses. You got 3 weeks and 4 weeks to wait. So now we're, I think we're essentially the second doses for the hospitals were already sent to them because they started first. Now 1A, week 3 and week 4 are now going to be eligible at some point next week for second doses. Those come into the regional hub. The regional hub then distributes those to the point of distribution from where people got their first doses. So in most cases, it will be to us. 4 weeks from now, people will be going back to the fairgrounds for their second dose of Pfizer. And again, at some point, we'll have Moderna and Pfizer. And Dr. Gupta will figure out how she wants her clinic to work, where Pfizer is this, Moderna is this. And logistically, we'll make sure that everybody's getting the right dose for the vaccine that they received.
I know it's a secondary consideration this year, but do you guys have any stats on flu and how that's coming?
Have you seen the flu yet?
Not a whole lot. I mean, if you go to New York State's website, that's what, there's a flu tracker, and we are running in for less than 5% somewhere, a lot less because of all these things, the mask and hand washing. We saw that, we are seeing that everywhere. So it's no surprise. People have gotten vaccines also. So flu, it worked very well in terms of flu, that people got vaccines, people got all these measures which are protecting them. So I think it's win-win for all. The challenge and a test will be when everybody is vaccinated with the COVID vaccine, gotten 2 dosage, and then we go to the next fall and then see what happens. Do people follow all these public health measures, which we would like them to do, because of so many other concerns, whether how long this vaccine's effectiveness will be, where there will be more strains. So I think what we would want people to stay cautiously optimistic. That is the key which we want people to do. So don't throw away your mask, don't abandon your practices of hand washing. And also one of the reasons is that people are working from home. You're not seeing a lot of schools also. There is a hybrid model which has been used also. So all these things have provided opportunity for flu virus not to create its wrath. And as a result, we are seeing less flu throughout the community and throughout the country. I think that is, and any place else which we have seen it too. So I hope that answers your question. And I got your answer for the person who went to the hospital not related with the vaccine was fine. So that, hopefully, that answers your questions. Yeah.
Other questions? All right, everybody, please be smart. Have a good weekend. I'm cheering really hard for a Packers-Bills Super Bowl. So go Bills and be safe. Let's be safe. We're making progress. Let's not go backwards. Thanks.